There is a quiet crisis unfolding in the lives of millions of Americans over 40, and it does not begin with recklessness or rebellion, but with a prescription pad. It begins with a sore back that will not heal, a night of restless sleep that turns into months, or a persistent anxiety that feels heavier with each passing responsibility. Somewhere along the way, a medication that once seemed like relief slowly becomes something else. It becomes routine. It becomes necessary. And then, almost invisibly, it becomes a risk. After the age of 40, the body changes. Stress accumulates. Loss becomes more familiar, and the margin for physiological resilience narrows. In that vulnerable space, pain medications, sleep aids, and anti-anxiety drugs can shift from therapeutic tools to subtle masters. This is not a story about weakness. It is a story about neurobiology, environment, and the powerful chemistry of the human brain. As we age, dopamine regulation becomes more fragile. The same dose that once produced relief now produces less effect, a phenomenon known in neuroscience as tolerance. The brain, always seeking equilibrium, compensates for repeated exposure to dopamine-elevating substances by reducing its own natural production or receptor sensitivity. What begins as symptom management gradually becomes neuroaptation. Over time, the absence of the drug creates discomfort that feels indistinguishable from the original problem. The pain seems worse, the insomnia more stubborn, the anxiety more urgent. Yet in many cases, the escalation is not a worsening of the underlying condition, but the brain's recalibrated reward system signaling imbalance. The tragedy is that individuals often interpret this as personal failure rather than predictable neurochemical consequence. They increase the dosage, add another medication, or layer alcohol on top of it, unknowingly deepening the cycle. After 40, life stresses intensify in ways that amplify this vulnerability. Careers reach high-stakes phases. Financial obligations peak. Aging parents require care. Children move toward independence. Hormonal shifts influence mood and sleep architecture. Chronic inflammation becomes more common. In this season of life, the desire for relief is rational and understandable. However, the modern pharmaceutical landscape offers immediate solutions for discomfort without demanding the slow work of adaptation. A pill can mute pain within minutes. A sedative can induce sleep in half an hour. An anxiolytic can quiet racing thoughts before an important meeting. The brain quickly learns this association. Discomfort equals medication equals relief. The reward pathway strengthens. Neural circuits become conditioned. The behavior becomes reinforced. Experts in addiction medicine, including leading clinicians such as Dr. Anna Lembke, have described how this cycle is not limited to illicit substances, but extends powerfully to legally prescribed drugs. The brain does not differentiate between a substance obtained on the street and one dispensed in a pharmacy. It responds to dopamine. It responds to repetition. It responds to expectation. Over time, the pursuit of relief can overshadow the original intent of healing. Subtle warning signs appear. Taking medication earlier than prescribed. Feeling uneasy when supply runs low. Thinking frequently about the next dose, or using the drug for emotional regulation rather than its intended purpose. These signals are often rationalized because the substance is medically sanctioned. What makes prescription drug dependence after 40 particularly complex is that it hides behind legitimacy. There is no dramatic collapse, no immediate external chaos. There is simply a gradual narrowing of emotional range and physiological independence. The person may still function, still work, still maintain relationships, yet feel increasingly tethered to a chemical lifeline. The question that emerges is not whether relief is justified, but whether the cost is quietly rising beneath the surface. The most unsettling part of prescription drug dependence after 40 is that it rarely announces itself with drama. Instead, it advances with subtlety, embedding itself into daily rituals until it feels inseparable from survival. What begins as a solution slowly reshapes identity. The person who once believed they were resilient now wonders why they cannot sleep without assistance. The professional who once handled pressure with composure begins to fear ordinary stress without chemical support. The body adapts, recalibrates, and then demands continuity. This is the paradox of dopamine homeostasis. The more artificially we elevate pleasure or suppress discomfort, the more the brain compensates by tipping the scale toward pain. The result is not lasting relief, but a growing background hum of unease. Over time, individuals may notice that even when medicated, satisfaction feels muted, joy feels blunted, and motivation feels thinner than it once was. The medication that promised stability quietly erodes the brain's innate capacity to regulate itself. Suspense enters the story at the moment of realization, which often arrives unexpectedly. It may come during a routine pharmacy visit when an early refill request raises a question. It may surface in a physician's office when dosage adjustments become more frequent. It may strike in the stillness of a night when, despite taking the prescribed pill, sleep does not arrive. In that moment, an unsettling thought appears. What if the medication is no longer solving the problem but perpetuating it? This question is uncomfortable because it challenges a deeply ingrained belief that relief must come from outside the self. For many over 40, acknowledging this possibility feels destabilizing, as though the ground beneath them is shifting. The medication has become a psychological anchor, a symbol of control in a life that often feels increasingly unpredictable. Neuroscience explains why this transition is so insidious. Chronic exposure to opioids, benzodiazepines, or sedative hypnotics alters receptor density, neurotransmitter balance, and stress response pathways. The hypothalamic pituitary adrenal axis becomes sensitized. Cortisol rhythms shift. Sleep architecture fragments. Pain thresholds lower. Anxiety intensifies in the absence of the drug. What feels like a worsening of the original condition may in fact be withdrawal masquerading as illness. This phenomenon traps individuals in a feedback loop where each attempt to reduce use temporarily amplifies discomfort, reinforcing the belief that the medication is indispensable. The brain's predictive coding system learns to anticipate the drug, and when the expected dopamine surge does not arrive, it registers that absence as distress. Yet beneath this biological adaptation lies a deeper philosophical tension. After 40, many confront existential questions about aging, mortality, relevance, and meaning. Physical aches can symbolize vulnerability. Insomnia can magnify regret. Anxiety can echo unresolved fears about the future. Medications can numb not only symptoms, but also signals that may be inviting transformation. When we anesthetize discomfort too quickly, we may miss the information it carries. Pain can prompt lifestyle recalibration. Sleeplessness can reveal chronic overstimulation. Anxiety can expose boundaries that need reinforcement. The risk is not that medication is inherently harmful, but that it becomes the sole strategy for navigating complexity. The turning point, though rarely dramatic, begins with awareness. It begins with observing patterns without judgment. It begins with asking whether the current trajectory aligns with long-term vitality. Dependence thrives in secrecy and self-criticism, but it weakens under curiosity and accountability. When individuals examine their relationship with medication honestly, they often discover that what they truly seek is not chemical relief, but restoration of agency. The suspense is whether they will have the courage to step into that awareness and consider that the path forward may require discomfort before it delivers freedom. Freedom from prescription drug dependence after 40 does not begin with abrupt rejection or dramatic declarations. It begins with recalibration. It begins with understanding that the brain is plastic, adaptable, and capable of restoring balance when given time and intentional structure. The same neurobiology that allowed dependence to develop can also support recovery. Dopamine pathways can reset. Receptor sensitivity can normalize. Stress systems can stabilize. But this process requires patience because the brain heals on a slower timeline than the culture of instant relief. The first phase often involves medically supervised tapering, not as punishment, but as protection against destabilizing withdrawal. Gradual reduction allows neural circuits to re-engage their intrinsic regulatory mechanisms. During this period, discomfort may temporarily intensify, and that escalation can feel frightening. Yet within that discomfort lies evidence of recalibration, proof that the nervous system is learning to function without artificial amplification. Equally critical is replacing the singular reliance on medication with diversified strategies for resilience. After 40, sustainable vitality depends on foundational disciplines, consistent sleep hygiene, strength training to counter sarcopenia, anti-inflammatory nutrition, sunlight exposure to regulate circadian rhythms, and deliberate stress modulation practices such as breathwork or mindfulness. These are not trendy add-ons. They are biological interventions that influence neurotransmitter balance and endocrine stability. Physical movement increases endogenous endorphins and dopamine in a self-limiting, regulatory way. Social connection releases oxytocin, buffering stress responses. Purposeful work and meaningful relationships stimulate reward pathways without destabilizing them. Recovery, therefore, is not merely subtraction of a drug, but reconstruction of a lifestyle that supports equilibrium. There is also a psychological dimension that demands courage. Many individuals discover that beneath dependence lies unprocessed grief, unresolved trauma, or chronic self-expectation that has gone unexamined for decades. Medication may have muted these signals, but healing invites engagement with them. Structured therapy, peer accountability groups, and honest conversations with trusted physicians create an ecosystem of support. Transparency transforms shame into strategy. The narrative shifts from personal weakness to adaptive response that simply outlived its usefulness. Over time, as the brain regains balance, emotional range often widens. Joy feels more authentic. Pain feels proportionate rather than catastrophic. Sleep, though imperfect, becomes restorative without chemical sedation. The philosophical insight at the center of this journey is that suffering within limits can be instructive. Discomfort signals disequilibrium. When addressed with curiosity rather than avoidance, it directs growth. The midlife years are not solely about decline, they are about refinement. The nervous system may be less forgiving, but it is also wiser. Individuals who navigate prescription drug dependence consciously often emerge with deeper self-awareness and more disciplined habits than they possessed in youth. They learn that relief purchased at the cost of autonomy is too expensive. They discover that resilience is not the absence of pain, but the capacity to metabolize it without surrendering agency. This transformation is neither immediate nor effortless. There may be setbacks. There may be days when the simplicity of a pill seems alluring. Yet each day of intentional recalibration strengthens neural pathways associated with mastery rather than compulsion. Over months, sometimes years, the baseline shifts. Energy stabilizes. Cognitive clarity improves. Emotional regulation strengthens. The individual who once felt tethered to a prescription begins to recognize a different identity emerging, one grounded in informed choice and sustainable equilibrium. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.